Hello dear students. Today we will discuss a new theme, diseases of the liver. And I repeat you, normal anatomical and histological structure of the liver. Liver is found in the abdominal cavity, in the right part of abdominal cavity, and includes two parts, right lobe and left lobe. Liver has brown color, solid elastic consistency, and histologically includes many lobules with central vein, hepatocytes, and in the between lobules we see accumulation of vein, bile duct, and arteria. There are four types of diseases in the liver. Hepatosis, osis means dystrophy and necrosis. Hepatitis means inflammation. Cirrhosis, abnormal regeneration and growth of connective tissue, and tumors of the liver. And first information is about hepatosis. What's this hepatosis? I told you that the group of diseases characterized by dystrophy and necrosis of hepatocytes. Hepatosis can be acute and chronic. Synonyms of acute hepatosis: massive progressive necrosis of the liver or toxic dystrophy of the liver. Chronic hepatosis has second name, fatty degeneration. And first information is about acute hepatosis or massive progressive necrosis of the liver. Etiological factors are exogenous and endogenous poisons, intoxications. Exogenous fungi, food toxins, many toxins. Endogenous due to gestosis of pregnancy, thyroid toxicosis. In pathogenesis, we see action of toxic substances to the hepatocyte directly, mainly in the central part of lobules. There are two stages, morphogenesis. There are two stages of massive progressive necrosis of the liver. First stage of yellow degeneration in the first, second weeks. What can we see? We see fatty degeneration. Liver is enlarged, has flabby consistency and yellow color. In the second stage of red degeneration, in the third week, we see massive necrosis of the hepatocytes and lysis of those hepatocytes, and we see I'm sorry. And we see red color, flabby consistency, and decrease in size. Look, in this histological photo, you can see fatty dystrophy into the hepatocytes and abnormal structure of histological examination. In this photo, you can see massive necrosis of the hepatocytes and lysis of those hepatocytes. In this photo, you can see fatty dystrophy and as a complication, bleeding diathesis in the skin. Histological examination of massive central-lobular necrosis, massive necrosis in the liver, yellow color, increasing size. Chronic form of hepatosis, fatty hepatosis. Etiology is chronic intoxication, alcohol intoxication, drugs, due to metabolic disorders, due to diabetes mellitus, defective protein nutrition, excessive fat consumption, cardiac insufficiency due to chronic anemia. Morphologically, we see accumulation in the hepatocytes, fat droplets. At first, very, very small, and more and more. Which stages of development of chronic hepatosis? Simple obesity of the liver of hepatocytes, obesity in combination with the necrosis of hepatocytes and mesenchymal cellular reaction, and obesity in combination with the reorganization of tissue, and in the outcome we see formation of portal cirrhosis in the liver. Look, in this photo you can see fatty hepatosis, chronic form, with fatty degeneration, growth of connective tissue with reorganization of structure of the liver, fatty changes, and growth of connective tissue, the pre-cirrhosis stage. The next information about hepatitis. Hepatitis is the inflammation in the liver. In classification, we tell about primary, the basic first disease, and secondary as a complication of another diseases. According to the course, may be acute and chronic. In the etiology of primary hepatitis, we more often we see viruses A, B, C, D, and other. Alcohol hepatitis and medical or drugs. What about different types of hepatitis? And first information about viral hepatitis A or epidemic Watkins disease. This is infectious disease with the viral nature expressed through primary lesion of liver and gastrointestinal system. Course more often is acute, but may be chronic. Which forms, clinical morphological forms of viral hepatitis A? More often we see cyclic icteric form with jaundice. Maybe non-icteric, this form is more favorable without jaundice, cholestatic due to cholestasis, and malignant necrotic with massive necrosis. Which morphological signs? Due to histological examination, we see special characteristic of viral hepatitis A. At first, protein degeneration, parenchymatose, hydropic degeneration, proliferation of Kupffer cells, lymphohistiocytic infiltration, and specific changes, Councilman's bodies. What's this? This necrotic hepatocyte look like as fragmented eosinophilic bodies. Look, Councilman bodies, eosinophilic small necrotic hepatocytes, proliferation of lymphohistiocytes and hydropic dystrophy in the hepatocytes. Infiltration by lymphoplasma histiocytes. This necrosis Councilman's body. Due to necrotic form is unfavorable form, we see massive necrosis. This unfavorable form. Due to necrotic form, after necrotic form, we can see massive destruction, massive necrosis, and post-necrotic cirrhosis formation. Due to cholestatic form, we see bile thrombi and mechanical jaundice. After this form of hepatitis A, we can see cirrhosis 2, bile cirrhosis. If we tell about chronic hepatitis, symptomatic, biochemical, or serologic evidence of continuing of or relapsing hepatic disease for more than 6 months, optimally with histologically documented inflammation and necrosis is taken to mean chronic hepatitis. Etiological forms of hepatitis. Hepatitis B, C, and D. What about hepatitis B virus? Develops in more than 90% of infected neonates and 5% of infected adults, of whom 1/4 progresses to cirrhosis. Hepatitis C virus develops in more than 50% of infected patients, of whom half progresses to cirrhosis. Hepatitis D virus, rare in acute hepatitis D virus, hepatitis B virus co-infection. A more severe chronic hepatitis is the most frequent outcome of hepatitis D virus superinfection. Since 1968, chronic hepatitis has been classified according to the extent of inflammation. There are two main forms. Histologically, we see two forms. First, chronic persistent hepatitis, in which inflammation is confined to the portal tracts, is more favorable form. Chronic active hepatitis, in which portal tract inflammation spills into parenchyma and surrounding regions of necrotic hepatocytes. Active hepatitis is unfavorable form with fast reorganization of tissue and formation of cirrhosis. In this photo, you can see chronic active hepatitis. Liver shows significant collapse, indicative of progression to cirrhosis, portal cirrhosis. In this histological photo, you can see chronic hepatitis. We see proliferation of lymphocytes and growth of connective tissue. The limiting plate regions are blurred due to inflammatory infiltrate. This chronic persistent hepatitis. Chronic viral hepatitis manifests as a portal inflammatory infiltrate between lobules. Infiltration between lobules. The next information about alcohol hepatitis. And in this slide, you can see information for your smile. My doctor said only 1 glass of alcohol per day. I can live with that. Alcoholic liver disease and information about alcoholic hepatitis. Which specificity of alcoholic hepatitis? Due to alcoholic hepatitis, we see fatty dystrophy and necrosis of hepatocytes. We see special Mallory's bodies, alcoholic abnormal hyaline into the hepatocytes, and prevalence of neutrophils in the infiltrate. The outcome of alcoholic hepatitis was the formation of portal cirrhosis. In this photo, you can see anatomical picture and histological picture of alcoholic hepatitis with accumulation of Mallory's hyaline into the hepatocytes. In this photo, we can see fatty changes and formation of Mallory's bodies into the hepatocytes. Alcohol, hyaline, Mallory's bodies. The next information about cirrhosis. What's this? Definition is a chronic disease of liver which is characterized by hepatic failure due to structural reorganization of liver and growth of connective tissue. Which kinds of cirrhosis according to the etiology? After infectious, after hepatitis, metabolic alimentary due to abdominal diet, biliary cirrhosis due to obstruction of bile ducts, dyscirculatory due to venous hyperemia, chronic venous hyperemia, due to intoxications, alcoholic, or toxic allergic forms. According to the morphology and clinical morphological changes, we see three types of cirrhosis. Post-necrotic, after necrosis, portal, due to chronic alcohol diseases, due to chronic hepatitis, and biliary, due to obstruction of bile ducts. Cirrhosis means orange color. In this slide, you can see normal liver and liver on incision, and liver due to cirrhosis, decrease in size, solid consistency, and small granule surface due to portal cirrhosis. Due to biliary cirrhosis, we see green color as a result of coloration by bile. Portal or micronodular cirrhosis. Liver is decreased in size, has solid consistency as a result of growth of connective tissue, and small granule surface, and on incision we see small nodes formation. Due to post-necrotic or macronodular cirrhosis, we see decrease in size of liver, solid consistency too, but formation of large nodules, more than 1 centimeter. As a complication of cirrhosis, we see portal hypertension as a result of pressure to portal vein with help of many nodes due to cirrhosis. As a result, we see accumulation of liquid in the abdominal cavity, ascites formation, and expanded veins in the esophagus, in the anus, and the abdominal skin. In this photo, you can see portal cirrhosis, micronodular cirrhosis, green color, biliary cirrhosis. This macronodular cirrhosis, post-necrotic form, this small granule. Congestive cirrhosis, in long-standing condition, the central regions suffer the greatest injury. Primary biliary cirrhosis, inflamed and destroyed bile ducts are characteristic of these disorders. Histological, portal areas contain an extensive scarring process, growth of connective tissue, obliterating vascular canals as well as bile ducts, and destruction of function of the liver. There are four main clinical consequences. First, ascites, I told you, is a result of portal hypertension. As a result of portal hypertension, we see opening of portosystemic venous shunts in the esophagus, in the anus, and in the abdominal skin around umbilical. Congestive splenomegaly is a result of pressure to the portal vein, and hepatic encephalopathy is a result of disturbance of hepatic function and intoxication and encephalopathy. Which complications of cirrhosis? Chronic liver insufficiency with coma, bleeding from the expanded veins in the esophagus and stomach, ascites and ascites with peritonitis, thrombosis of the portal vein, and cancer of the liver. In this photo, you can see opening shunts, caput medusae, in the skin of abdominal part. Expanded esophageal veins, with rupture. Due to chronic cholestasis, the accumulation of bile salts and their deposition in the skin leads to the strong ecteric stimulus. In this photo, you can see cirrhosis with formation of abnormal nodes, lobules, with growth of connective tissue. Macronodular cirrhosis, growth of connective tissue, and infiltration by lymphocytes. And the last information is about liver cancer. As a background disease due to liver cancer, you see cirrhosis. We're told now about this situation. Anatomical forms. As a node, we see cancer as a node formation, nodular form. As a massive form and diffuse. Histologically, we see two types of cancer of the liver. From hepatocytes, hepatocellular carcinoma. From epithelium in the bile ducts, cholangiocellular carcinoma. In this photo, you can see nodular form of cancer. In this photo, you can see metastatic affected of the liver, metastasis in the liver. This massive form of cancer, massive form of cancer, massive form of cancer. Histologically, hepatocellular variant. In the left side, we see normal hepatocytes. In the right side, we see cancer cells from hepatocytes. Anatomical picture of hepatocellular carcinoma. In this photo, you can see hepatocellular carcinoma with invasion of portal vein. In this photo, you can see hepatocellular carcinoma. Cholangiocellular carcinoma, anatomical picture, and histologically as a gland formation. But more often in our region, we see metastasis in the liver from stomach or large intestine. Thank you for your attention.